Yeah, again, Deb, very fluid. So just yesterday, we completed erecting the two what we call surge tents. You may recall a couple years ago when we had a really severe flu season, we put these two tents up in our parking lot, the east parking lot outside the emergency department. So those tents have now gone up in front of the emergency department. We cleverly call them Tent 1 and Tent 2. But so Tent 1, which is the first tent you'd approach, is now kind of the outside triage area. So every patient will come into that tent because we're trying to keep patients out of the medical center to reduce exposure. So you'll first come in Tent 1. You will be triaged by a provider. If you need immediate emergency attention, you will immediately come into the emergency department and be handled just like we would normally handle going back into the treatment area. If you're suffering a heart attack or a stroke or something that requires immediate emergency attention, you'll go right into the ED. If you appear to be otherwise okay, but you're exhibiting respiratory problems, then you will be moved into Tent 2. And Tent 2 is where we will cohort patients that are not in emergency condition, but appear to have respiratory type symptoms, may have a fever. In that instance, we will put a mask on you and we will put you in Tent 2, seated 6 feet apart. So we're practicing, good social distancing there. And then we have a third tent that is right next to Tent 2, where you'll move into there and we will collect the specimen, do a nasal swab, and then send that to for testing. And then after that's all done, again, if it looks like you can be discharged home, we'll send you home and monitor you and report the test results to you at that time. If it looks like we're concerned that your condition could deteriorate rapidly, then you'll be brought into the emergency department, further assessed and treated there, and determine if you need to be admitted.
Okay, thank you. So what is Kaweah Delta doing to protect their staff?
So that's probably, we have so many great concerns during this time, and one of the greatest is protecting our workforce. So our 5,000 employees, we have 1,200 nurses, we have almost 700 physicians and advanced practice providers, and those are the people that are selflessly, taking care of us. And so we want to keep them as healthy as possible. So the first thing we do, obviously, is we use what's called personal protective equipment, or PPE, and that includes things like N95 masks, surgical masks, gloves, face shields, gowns. So those are very important supplies that we have in stock. And fortunately, we're very glad to see the President declare a national emergency, because that opened up the national stockpile, which now allows those personal protective equipment supplies to flow to the state. We just a couple days ago, we received close to 19,000 additional N95 masks and surgical masks. So that was very good to see. So if we have a patient that is exhibiting respiratory symptoms, we put generally a mask on them, because that's actually how to best protect. Is I know a lot of people think that, well, I need to wear a mask to protect me, but wearing a mask, particularly like a surgical mask, doesn't provide a whole lot of protection, just general protection from contracting the virus. You really want to put the mask on the patient so that when they cough or they sneeze, that they don't expel droplets or aerosol that could then infect people. So anybody that has a respiratory condition, we put a mask on them first and foremost to protect our staff. But also, if we do have staff that are taking care of patients that have respiratory conditions, then they will wear a mask as well. So patients or nurses, physicians, other staff that are directly taking care of certainly a patient that is tested positive for coronavirus or patients with respiratory conditions, because this flu is still out there, colds are still out there, other types of airborne viruses are always out there. So we put a mask on the patient and we put a mask on the caregiver. So that's the way we best protect them. We do put patients in isolation rooms when they have respiratory. We have 11 negative pressure rooms that we put patients in so that it keeps airflow inside the room. Constantly sanitizing, wiping down surfaces to protect, having all of our providers are gelling in and gelling out of the rooms, washing their hands frequently, not touching their faces. If we do have employees that have been exposed, when they're asymptomatic, they are still permitted to work in the hospital, but we will have them wear a mask. If they remain asymptomatic through the whole 14-day period, then they will continue to work and hopefully show no symptoms whatsoever. But if they do start showing symptoms, then again we'll send them home.